Hi, I am Dr. Chakradhar, consultant neurologist at Renova Hospital, Sanath Nagar. Now, I will be discussing briefly about low back pain, which is the most frequent and common problem in these days in the younger generation. Coming to the topic, low back pain, which means perception of the pain over the back of the waist or just above the buttock region, most of the symptoms, and sometimes it can also even radiate along the lower limb, either one side or on the both sides. Now, commonly, the reason for this is usually due to the compression of the nerve root at the intervertebral disc, that is the spine region. Due to the routine process of aging, there will be wear and tear within the vertebral column and the spine as well as the disc. It becomes dehydrated and that starts protruding along with the age, and the nerve gets compression. This most of the time is called, we medically call it as lumbar spondylosis. However, there are several other causes that can affect the this part of the spine, resulting in the low back pain. However, they are little less common. So, predominantly speaking now on lumbar spondylosis, these days we are seeing most of them even in the younger generation. Previously, this used to be a general problem in the aged population or older individuals, as because this is a degenerative process, and this is the reason being the wear and tear of the tissues in and around the lower spine region. But in case of the younger generations who are yet fit, these days they are complaining more of these symptoms. The common reason is because of the prolonged sitting and maintaining an abnormal posture, leading to the excessive strain on the structures of the low back. This results in a giveaway between the vertebra and causing the early symptoms of this problem of low back pain, which common in routine they call it as sciatica. However, this is a different issue. The name medically is different. Sciatica is the compression of the nerve, sciatic nerve, but the most common problem would be the lumbar spondylosis. As a result, what one should do, or what should be one doing to avoid this initially for the prevention of low back pain or lumbar spondylosis? One should have a proper posturing. That is, one should have an ergonomic chair when they are supposed to sit for prolonged hours for like 8 to 10 hours, which has become a common routine in case of softwares or those who are associated with the systems. So a back support is must, and when one should is sitting, they should not lean forward or bend the neck, which increases the pressure over the spine region, causing this spondylosis. And the other thing is routine regular exercises that strengthens the paraspinal muscles and makes the ligaments strong, thereby avoiding more of the pressure over the intervertebral disc that eventually avoids the disc bulge. Other thing is maintaining a healthy and diet rich in calcium, vitamin D3, and everyday sunlight exposure is also becoming more and more important in this case of individuals. Coming to the treatment of this, whenever a person suppose this can be evaluated either by a neurologist or an orthopedic or a spine specialist. Usually, symptomatic management will be given with analgesics and some nerve medicine. However, if the symptoms are severe or unbearable pain that is radiating, one need to rule out other causes such as spinal infections or any hemorrhage or other causes, which can be ruled out by looking at a scan, but preferably the MRI of the lumbar spine. That gives us the most of the etiologies, underlying causes. Depending upon the underlying causes, the treatment varies. However, most commonly the lumbar spondylosis, in case of mild to moderate degrees, can be managed with medicines and physiotherapy. However, when the disc protrusion is severe and there is annular tear causing the disc bulge severe, leading to the significant compression and causing the weakness as well as the sensory impairment along the nerve, then one has to undergo the surgery These days, even the surgery has become very simple by the endoscopic procedures, and which has a very early recovery and decreased morbidity post surgical periods. So one need not get afraid of any surgery nowadays in case of severe symptoms. And as I told, prevention is better than cure. So maintain a proper position and avoid any strains or excessive lifting of sudden lifting of heavy weights, and maintain a healthy habits. Thank you.